Well, welcome back to the Anja Health podcast. Today, I'm super excited to have Dr. Alex Melhuish, a medical doctor and a health provider at Vitalia 24, which is specialized in the field of cord blood and cord blood derived products and treatment with those products for especially neurodegenerative diseases and regenerative medicine in general. But Dr. Melhuish is a regenerative medicine physician based out of Europe, and yeah, we're super excited to chat today. You're actually our first guest that has a specialty in stem cell treatments in the space. We've previously mainly talked with physicians that are specialized in pregnancy and birth, so OBGYNs and such. But yeah, super excited to have you here today.
Thank you, Catherine. I'm also very excited. Great. We've been following your podcast for a while now. Greatly appreciate all the work you're doing in bringing awareness to the important issue of biobank, and not only biobanking, but the collection of the materials from patients and others. Because, as you know, cord blood is essentially very valuable to not only to current generations, but future people that will need the treatments or therapeutic applications that cord blood banking can offer now, hopefully in the future.
Definitely. I agree. Well, I'd love to know more about your background, especially as a physician. I know you have various degrees, so I'd love to cover how you got to the stem cell space in particular and why you like to focus on cord blood within the stem cell space.
I started my academic career 25 years ago, now in 1999, where I first studied genetics and bioinformatics at UCL University College London. It was a bachelor course. Primarily in my research, in third year research, I primarily was interested in iPS, induced pluripotent stem cells. Of course, it was pretty new back then, and we were looking at how to maintain cell integrity and to maintain cell viability. But I mean, this topic sector is leaps and bounds in a quarter century since I started. After that, I did a master's in biochemistry from Canterbury Christchurch Biomedical Research Facility, Kent. And then after that, after working 2 years in the laboratory, working on prions, which are a type of set protein folding. It was the last days of mad cow disease funding. And after that, I went to study medicine. After completing medicine 6 years, I went back to the laboratory, this time as a medical science investigator doing research. Again, I worked at the Department of Cell and Developmental Biology at the university here, and I trained in the field of translational medicine, more looking at lung cell model, lung organs, where we produce synthetic lung tissues for doing research on new medication or new pathological disease model. First of all, the use of bone marrow in the treatment of very acute illnesses. And just coincidentally, we were allowed to use cord blood in certain cases. And we saw the efficacy and the low mortality and decrease in infection risk by treating with cord blood as opposed to doing the invasive, pretty destructive and infection-prone bone marrow transplant procedures. So we decided to, instead of stopping transfusions, we decided to opt to bone marrow aspiration to go direct to cord blood. And that was by a family member, in fact, someone that had already banked their cord blood for their first child, and asked the right questions to the right people, and we got the clearance. We started taking the cord blood specifically from a certain biobank, from certain patients. But yeah, that's how I got into cord blood.
That's awesome. Thank you for sharing. So, yeah, I guess thinking about the cord blood space in general, when it comes to cord blood banking, especially private banking, at Anja Health, we obviously do private banking for parents. So, why do you think it's an important option for families to consider private banking for themselves versus just donation?
I mean, when you donate, I think everyone should always try to donate to public,
Hmm.
in the sense that the more blood cord units available, the more people banking, the more chances we have to treat patients. For example, there are specific ethnic groups with specific different HLA type, antigen surface of their cells, where, for example, there's some Native American, Indigenous American blood types, which in turn are restricted in how much they can use, for example, organ transplants, cord blood transplants, because the halotype is restricted for them. Even now, 90% of it is thrown away, placenta and cord. I mean, there's no signature from the family member, oh, couldn't take it.
Yeah.
So I think in this case, if you have the means, if you have the opportunity, not only economic but also physical means, because there are countries where there are no biobank facilities. People are taking it. There are agents that come to the birth and wait there and take it and put it in special containers and literally drive to the airport in some
Yeah.
country to get it to a reputable biobank. So at the end of the day, I think if you have the means and the opportunity to biobank, it's better than putting money aside for kids' college. In the future, you don't know what's going on. I mean, we've had patients where 3 or 4 years old, they've developed signs of AML and all sorts of key lymphomas. And in some cases, it wasn't for the fact that they had a younger sibling, for example, about to be born. There'd be no chance for them to benefit from the amazing therapies and the amazing outcomes that certain diseases treated using cord blood and cord blood.
Right.
But again, when it comes to private banking, you have to do your research. Unfortunately, there are a lot of distributable blood banks or biobanks, sorry, we try to look at. I mean, when it comes to choosing your biobank, you have to look for accreditation. Two major accreditations that we always suggest to our patients or potential patients and other like friends and family. One is the AABB, which is the Association for the Advancement of Blood and Biotherapies. This is an international organization. Look at the website; they have a good list of AABB accredited biobanks and a couple of stem cell therapies. And the second is the Foundation for the Accreditation of Cellular Therapy. Now, this one and both organizations have on-site inspection, so you have to be careful, and also you have to be careful that cord blood has a finite shelf life. So the way it's stored, how it's stored, and where it's being stored, these all are very important factors, not only for today, but for when, God forbid, the day that you need it, it doesn't turn out to be contaminated or poorly stored, which is something we used to see. I think you're fully aware of it 5, 10 years ago with the implement the internet and people doing their research. A lot of these fly-by-night biobank facilities are being closed down, if not by themselves, by their local government agencies. So, I mean, over the past 5 years, I've personally have more confidence in private blood biobank facilities because of the stringent guidelines and oversight going through as an industry. So
Yeah, definitely. Yeah, I know that there was that New York Times article that came out a couple months ago that discussed a parent in particular that was disgruntled because when she tried to use her cord blood, she was told that it was contaminated. And so, yeah, I guess one thing that we always mention to parents is in certain cases, you can actually then treat the cord blood with antibiotics depending on what it's contaminated with. So, yeah, I'd love to get your thoughts on that. If in the case that parents are worried that it might be contaminated, what kind of solutions are there?
I mean, first of all, just the fact that they were told that it was contaminated should give them a bit of confidence in the protocols and the safety checkpoints that are now found in the biobank industry. I mean, how it was contaminated and with what it was contaminated can vary. I mean, there are certain viral infections or bacterial infections. I say that like it's a person, but really what it is that the cells are bathed in a diluted version of biampicin or macrolide antibiotic. This in itself reduces the activity of the cells, but then over time, over a period of 12 to 18 hours, they're reintubated, and then the cell levels regrow again after the initial shock of the antibiotic and also the solution change. So, and then of course, it's recultured to see if there's existing bacteria left. I mean, there's a lot of ways around it, a lot of work, but if the material is unsalvageable, they cannot get back in any useful material because of the risk of a infection to the actual recipient of the cord blood. I mean, there's not much you can do. So, I mean, in any procedure where you're storing tissue, there's always a chance of being infected. So, again, the competence of the healthcare worker who's not only storing the cord blood, but the taking of the cord blood from the cord and the central material is just as important. So you've got to be careful.
Okay, awesome. I'd love to explore why cord blood and placenta in particular is such a potent stem cell therapy and what makes that more effective in certain conditions than, for instance, stem cells from bone marrow or other resources.
Yes, well, as we mentioned previously, bone marrow aspiration is invasive, painful, and there's an incredibly increased risk of infection because you're not only penetrating external skin, but going into the bone to remove the marrow. So you're literally making a nice clean road or highway for the external environment to come into what is normally a sterile tissue, the marrow tissue. First off the bat, cord blood is superior in the fact that you're not doing anything invasive. The risk of infection due to invasive procedure is zero, not minimal, but zero. And also, by taking cord blood, you're reducing, as we mentioned before, the risk of the patient presenting with viral infections or bacterial infections that they've got from the outside of the intrinsic environment. Because, I mean, they've just come out from a closed environment into the world. That's when you want to take that material as soon as possible.
Okay, interesting. And I'd also love to get your take on autologous use versus allogeneic use of stem
Yeah.
cells, in particular, thinking about both cord blood and bone marrow.
Autologous, auto means from the person's own body, own stem cell reservoir or tissue, and allogeneic, which means different. Allo means different. This is where you use stem cells from the donor. Generally, the donors that we look for, they should have a HLA antigens or human leukocyte antigens should be a match for your donor patient from the donor itself. But with cord blood, I mean, the cord blood, even when it's allergenic and autogenic, there are less immunological rejection or elimination used, even when you use allergenic cord blood. So to go back to the unfortunate case, even if they're unable to use their own cord blood, there is a possibility to use allogenic cord blood if your local medical authority has ratified. So unfortunately, for example, in Europe, it's still a hot button issue. I mean, a lot of countries are not allowing it. There are forms of research, get over the legislation, but still, I mean, doing it in a grey area or doing the full backing of your medical authority government is two different worlds. So, I mean, in Europe, it's not really allowed, but in countries such as Turkey and other countries, they're full on looking towards using more allergenic cord blood units. Again, because cord blood banking has taken off, a lot of people are banking, especially countries where historically they have a strong IVF medical sector. So IVF also incorporates a lot of overlap biobanking. So you have to bank a lot of biological material, sperm. So in countries, for example, which have a very strong IVF culture, biobanking for cord blood and even placenta has really taken off.
So I guess if you were given the choice for a patient between treating them with their own cord blood, being an autologous treatment, versus an allogeneic treatment, being someone else's cord blood, what would you choose?
Again, it depends on the patient and their disease states. I mean, there are certain diseases where you do not want to use their tissue because you're reincorporating either their genetic abnormalities or even their own infection back into their body. So in such cases, we prefer to use allogenic. But in the majority of cases, we always prefer to use the patient's own donor material, definitely.
Okay, I see. One study that I bring up a lot. So basically this New England Journal of Medicine study demonstrates a positive correlation between the months of survival following a stem cell treatment and then also whether they're closely related to the donor. So
Yeah.
I guess even if it's an allogeneic treatment where they themselves are not the donor, would you generally prefer them to be related to the donor, or do you think that it doesn't necessarily matter?
There are certain genetic diseases that can be passed on, say, from parents to the siblings, depending on the disease that we wish to treat. We have to exclude, for example, first filial generation. We have to exclude the siblings. We have to look towards to the maternal aunt, for example, or the paternal uncle, depending on which disease that we're looking for. But again, we will always prefer the closest donor. So, yeah. definitely.
Okay, awesome. On the note of HLA matching, one thing that we also always discuss with parents is the fact that ethnicity can play a role in
Yeah.
potentially needing cord blood stem cells. And that's largely because I typically explain that cord blood stem cells are generally solicited in high income areas. So then donor pools in the United States tend to lean white. So if you are not white, then the chances that you find a stem cell match can be really low. And I was once at a conference a few years ago where an OBGYN told me that she thinks that the correlation between HLA matching and ethnicity is incorrect because she feels like it kind of just groups people into, yeah, like certain assumptions, and it just leads to sort of like further medical racism and things like that, which I thought was interesting. But yeah, I'd love to get your opinion on why ethnicity might play a role in HLA matching and why people of color or those that are mixed race tend to have less access to stem cells.
It's a really good question. And the reason why it's a good question, I said the answer is quite well, but the question in itself leads us to look at, like you said, the socioeconomic disparities in biobank, not only in cord blood, not only in placenta banking, but in fact in communities where blood donation can be difficult. Historically speaking, especially like UK, the Indian subcontinent's ethnic markers, they have, and also the Indian subcontinent Muslim ethnic markers, Muslim not being an ethnicity but a religious group, but generally they have their own ethnicity divided north and south, for example, Pakistan, because historically it was quite a closed society in certain areas. From a genetic point of view, there is very little HLA differentiation between the population. However, when it comes to available blood, available donors, certain minorities, for example, Indian subcontinent, they're severely lacking. And it becomes a mismatch where you have to kind of hit 6 or 7 HLL types just to reduce the probability of a reaction. And it's the same in America with certain different ethnic groups. For example, African Americans, historically, as you said, they don't have the access, or it's not within the known education, society education, where their peer groups, as you know, there's certain peer groups where it was quite fashionable in the early 2000s to bank your cord blood, not for your kids, but for yourself. That's how it was advertised. But of course, these were the same companies that were trying to push cryopreservation for dead people. I'm sure you remember they were trying to do the biobanks for everything at the time. No, what I'm trying to say is it's a great question. I think you answered the question in a roundabout way when you asked it. It's down to education. Some groups of the country, some groups of society have not been fully educated the value in the significance, for example, cord blood banking. Also, again, it's down to socioeconomic needs. Some ethnic groups don't have the socioeconomic needs or the education in their own countries. For example, in subcontinent in the UK, they find it very difficult to find suitable donors, organ donors, or even stem cell in cord blood due to their specific HLA type that they possess.
So I guess if you had a message for pregnant parents who were people of color or mixed race, what would you tell them if they were considering whether or not to bank cord blood, cord tissue in the placenta?
I would always suggest, regardless of ethnicity or past history of genetic illness within the close family, that if you can afford it, do it. And if you can't afford it, and there is the chance to donate to a public biobank, I mean, do that as well. Because at the end of the day, even though there are more cord blood in private banks, the public blood banks, the public biobanks are the ones which are giving, I think, up to 4 times more units available than from the private bank. So at the end of the day, if you have the means to bank privately, you must do it. Insurance policy. Unfortunate to say that, but that's how you should consider it. And if you don't, try to bank it so you may have to use it for yourself later, or someone else will have to use it. So it's good to donate. 20 years ago, people never thought about donation. I mean, no, I don't know. When I die, I want my eyes, or when I die, I still want my heart. But especially in certain cultures, it's seen as taboo. But over time, both from media and from education, these pre-formed opinions have been eroded. And I kind of hope that this continues with biobanks, cord blood banks.
Yeah. Okay, awesome. So We've had some parents that are currently pregnant that are deciding whether or not they want to bank cord blood, cord tissue, or also the placenta. So, what would you say to parents that are considering whether or not they should bank their placenta? What is the potential for use for the placenta?
Well, when we think of biobank, we kind of only think about the nuchal, the cord blood. But I mean, taking the placenta in itself not only has more than one type of cord blood, that will want more than one type of stem cell. It contains hematopoietic stem cells, mesenchymal stem cells, and embryonic-like stem cells. All three of these stem cells, types of stem cells, they each have their own role. So at the end of the day, if you can bank your placenta, or they can take from the placenta, produce Wharton's jelly that produce stem cells, exosomes, or even cord blood products from your own placenta, you're at a great advantage when it comes to potential therapeutic application that you have.
I'd love to discuss some case studies, especially since you mainly day to day treat folks with stem cells from an umbilical cord and placenta. So, can you share some impactful success stories that you've seen from patients that have undergone cord blood, cord tissue, and placenta stem cell treatments, or any favorite highlights?
I'm not a big fan of patient testimonials, to be honest. Like, anyone can say, yes, we gave them stem cells, we gave them cord blood, and they started walking, talking, jumping. I'm more in favor of quantitative data and continuing the research and showing a difference. For example, you mentioned the study, Washington Post, is that right?
Yeah.
New York Times, they looked at hematological disorders in young children that had transplanted umbilical cord blood from a sibling donor. And for example, that research in itself for our community is very important because it showed that it was either the same or better survival rate in those children that received the umbilical cord blood in comparison to those that just received bone marrow transplantation. This is a kind of testimonial that I'd like to discuss, but I mean, there's always that one patient that sticks in your mind and you can always talk about. This was pretty early on in my career. I was in California at the time, and then we went down to Mexico to see an application at cord blood clinic there. I mean, the young lady, she dropped out of college, university, I was in the UK, college, because she couldn't use her hands, she couldn't walk, she hadn't been eating, she was having excessive muscle tremors, increased muscle weakness. After very simple transfusion of cord blood, only the next day she woke up and she dressed herself. This was a 18-year-old lady that couldn't go to university anymore because she couldn't do her button clothes, let alone carry a bag. She couldn't get dressed. She gave up horse riding, football. She would show all the pictures. She was doing state champion, private. After the first application, the next day, her fine motor control was improving. Within 5 to 6 days after treatment, she stayed around for physical therapy. She got dressed herself. She came downstairs and she made pancakes for her mum. I think seeing her mum crying like that and the fact that we kept in touch for the 3-month, 6-month follow-up afterwards, she went back to uni, went back to college, and she was living a full and independent life. I mean, things like that kind of stay in your mind, really.
Yeah, that's awesome. I've talked with some folks in the research space around stem cells that feel like sometimes it's hard to pinpoint if stem cells really were the cause of someone getting better. Were there any other treatments that patient was receiving at the time, or was it solely due to cord blood? And how did it work so quickly?
When it comes to the majority of diseases, which is, for example, the FDA approved diseases, applications of cord blood for these hematological diseases, we know how the cord blood works and in what way it makes the effect, and we have some expectation. But for example, in stroke patients and in certain patients with autism spectrum disorder, not every patient, but certain patients. For example, we don't treat every patient that applies. They have to have strict criteria. And one of them, the most essential criteria, is that cord blood, and in essence, the stem cells themselves, they're not magic. It's not a magic treatment. It has to be given knowing there's going to be a combined and prolonged application of physical therapy, cognitive therapy, dietary advisements, and also education. So, for example, our stroke patients, a lot of them said, oh, I'm going to get stems and I can walk. But, for example, we don't ever tell patients that you can walk. or you can recover. So there is a possibility. But with the application of stem cells, combination with proper medical physical therapy, occupational therapy, the effects of their hard work is multiplied. Stems can be considered a force multiplier in that respect. It's the NOS it's the nitric oxide in your engine, so to speak, that will help speed up your recovery or increase the beneficial effects of the treatments that you already have.
Okay, I see. Really interesting. Do you know what she had? I know you mentioned some tremors and things like that, but was there some kind of disease in particular that was causing all of that?
Yes, I kind of didn't want to say it, give too much information away,
Okay, that's okay.
but because I'm not sure she'll be watching.
Okay, yeah, no problem. But you were able to know like what the cause was?
Well, all of our patients have a confirmed diagnosis,
Yeah. Okay.
and then they go through the medical meeting and evaluation,
Right.
and then we decide if we can help, and if so, how much of a difference. I mean, a lot of people have been told a lot of crazy things. A lot of, as you know, especially when it comes to cord blood and the adjacent stem cell treatments in the world, there are a lot of charlatans, a lot of promises, both written and spoken. There are websites that people say that your MS, multiple sclerosis, for example, cystic fibrosis, they'll be fully cured. You see great improvements in cystic fibrosis patients. But they have to be of a certain age, they have to be active in their physical therapy, and even then, even the improvements that they have improve their quality of life. But it's not a full recovery for some of these diseases. For a stroke patient or traumatic stroke patients, the recovery that they've had after treatment, quite amazing. But again, it's disease specific, it's age specific, and there's no such thing as one size fits all. I mean, there are companies out there that give a 50, 60 disease containing list of about 50, 60 different diseases, and it's always the same treatment, it doesn't work. I wish it did. I really
Yeah.
wish it did. But again, it's education of the patient. Out of the 10 patients or 11, 10 patients that we get to the stage where we have medical consultation interview after they've presented the right information, one patient out of that 10 gets to the next stage where we're considering treating them with stem cells. So it's not suitable for everyone, but there are a lot of diseases which would benefit from having cord blood transfusion, cord blood associated stem products, definitely. But again, it's down to education and expectation, patient expectations. They have to be managed, like everything in medicine.
A really common question that we get is in general, what can cord blood stem cells treat? And cord tissue and placenta as well. So I know you mentioned cystic fibrosis, tremors. You also mentioned that it's very specific in certain cases. But like in general, if someone asked you that question, what diseases would you say like cord blood, cord tissue, and placenta stem cells like generally do treat?
Other than the recognized FDA approved hematological cancer diseases, we generally concentrate on stroke as a facility. Stroke, we've seen great therapeutic outcomes using the treatments that we have. And of course, some very limited autism patients, mostly younger patients. We don't treat patients younger than 3 years old. We try not to treat autistic patients older than 15, 16. But generally, we try to concentrate on what we do best, stroke and autism.
Okay, really interesting. I feel like autism research, when I've brought that up with physicians, they generally kind of brush it off like, oh, it's super early. Like, what is there to even say about cord blood and autism? So, yeah, I guess what is your take on, in general, the development of research and how does it actually impact kids with autism?
I'm sure you've done a quick literature research or literature review when it concerns articles on stem cell or cord blood treatments in autistic patients. When it comes to using cord blood and cord blood products in the treatment of autism patient, again, we have to consider the extent of the autism spectrum that the patient has, the extent of their learning difficulties, their social interaction problems, the extent of their diet. When it comes to actually stem cell treatments, most of the articles always come back to the same thing. The potency of the stem cells used, in other words, the viability, the vigor, the life of the stem cell. Also the number of stem cells, was it 2 million, 5 million, 3 million? And also the administration of stem cells. Now, stem cells are cells, they're quite big. So when it comes to for example, neurological diseases, we have seen greater therapeutic outcomes when we administer exosomes, which are derived from stem cells derived from cord blood and also from the placenta, because exosomes in themselves are a lot smaller. They can travel past the blood-brain barrier and give off the special vesicular secretory exosomes that can mediate or decrease neuroinflammation. When we use stem cells, we use it in conjunction with stem cell-derived exosomes. And just by doing that, and also the research has shown, or literature has shown, the efficacy of exosomes, the lack of reaction, the small size of vesicles themselves, and the fact that they themselves dictate to the body's own stem cells, which are being produced, increases the efficacy of any of our treatments by a magnitude that I can assume. But there's a greater effect by cord blood stem cells with cord blood exosomes. That's what our clinical experience has shown time and time again.
I see. So if someone stores cord blood, are they also storing exosomes? And can you define an exosome?
Yes, an exosome is a extravesicular, extracellular vesicle. What it is, it's cells. Think of a row of cells, and the only way they can communicate with each other is by changing the chemicals around them or secreting certain chemicals which are messages to each cell. Exosomes in themselves are not only packed full of these chemicals and these controlling cyto information giving chemicals, but they also dictate to surrounding cells what you need to do. So exosomes in that sense, generals, they tell other cells what to do and how to do it.
Okay, so if someone is banking their cord blood, they do also have exosomes with the cord blood, right?
Yes. And the thing about exosomes, they're very hard. They're very difficult to destroy. That's why you can freeze them. That's why you can harvest them. However, when they're in situ, within the actual cells themselves, around the cells, they can be destroyed. So just by the act of biobanking, you're reducing your viable exosomes. However, what can be done is you take the tissue, you put it through simple chemical processes where you bathe it in nutrients, and you restart some of the chemical cellular processes, and in return, you restart the exosome secretion. Of course, doing it that way, the viable amount of exosomes that you can harvest and collect after each generation cell growth is a lot less than directly taking it from the placenta when it hasn't been frozen, and taking it from there and growing as much exosomes as you can, centrifuging them up for collection, filtration. So there are limits to exosome collection when you're using biobank preserved biological material.
So you mentioned that you use umbilical cord blood and especially exosomes to help treat autism. What kind of improvements have you seen in children with autism after they receive cord blood stem cell treatment?
First of all, we've seen within a couple of days even increased concentration, increased mental capacity, lack of the physiological body movements that characterize children, the repetitive body movements, for example. Again, with sustained therapy, occupational and physical therapy, our young patients have improved eye contact, improved concentration at school, improved appetite, improved walking gait. So these are all very clearly evident. I mean, from the parents' point of view, definitely, so from the patient himself.
I see. Is it their own stem cells that they're mostly using, or is it a donor stem cells?
I mean, again, it depends on the patient's family and what they use. For example, most of our patients have poor access to biobanking. So at the time of birth, they weren't able to bank their cord blood. Patients like this, we tend to use allogeneic sourced stem cells.
I see. But if they have it available, are you able to use it for autism?
Definitely.
Okay. Awesome.
Definitely.
You mentioned that there are requirements for people to receive a stem cell treatment that you generally look for, at least for your clinic. So what are those requirements?
They have to be in a continuous physical rehabilitation program, a pedagogical, educational therapy program, and the parents have to be educated to a certain level to understand not only what the disease progression be or what the actual disease state entails for their child and for their partner. some cases. And then after that, if they can provide enough medical evidence and enough medical data to confirm their diagnosis, and to confirm that they've tried everything, they're continuously doing their pedagogical and behavioral therapies and cognitive therapies, then we can consider the addition of stem cells, cord blood stem cells, as an additional boost to help maintain improvement, or even boost improvement more than would be expected just by physical education rehabilitation. So we're a strong believer in stem cells are great, but they're not magic. You can't just give it and then expect the result. You've got to put the work. So if we can see that there's a confirmed diagnosis, that the patient's family has tried everything that to try the rehabilitation, then then they get to the next step of evaluation.
I see. So are you able to attribute the cause of them getting better and the improvement to cord blood stem cells? Because I've heard some doubts amongst like other researchers that they can't really be sure that it's the stem cells if they're also doing physical therapy and things like that.
Would they have had the same improvements over time if they hadn't had cord blood cells?
Yeah.
I've had this conversation dozens of times, and it's hard to say without the treatments they would have got this much better. But I've seen patients with the treatment have dramatic improvements in a short period of time. Now, to maintain those improvements, to keep those improvements going, the application of physical therapy, the application of cognitive and educational therapy is essential, in my opinion, because you've given these stem cells, you've given the cord blood, and now you need that person to stretch their limits, to push themselves. It's quite easy to give it if you can find it, but at the end of the day, what you want to see are major improvements, not just a little bit of appetite, they're better at sleep. You want patients that are non-verbal to start saying, I want water, or I love you. You understand? And things like this we've seen with our patients. And our patient family members, after they hear those words, or their kids are able to go to a normal school with, of course, some special needs provided, that's when I know that treatment works. And it's not just that exome-like type some improvement. No, there's definitely a dramatic impact of cord blood-derived stem cell products in these diseases.
Okay. How does the actual stem cell treatment work? Is it an intravenous treatment that they receive and it's just like they sit and receive a blood transfusion essentially for an hour and that's it?
Yeah, I mean, I could say essentially that's it, but depending on what we treat, we combine it with the exosomes. So we can give exosomes either IV, but generally our autistic patients, they have intranasal exosomes that they can take after their IV applications. They take the intranasal exosome with them to continue the stem cell treatment at home. Because let's face it, with generally autism patients, any change in environments, any change in their normal routine, not for all of them, but for many of them, is quite stressful. It's very stressful, not quite, very, very stressful. So to minimize that stress, we like to continue the treatment at home by giving them intranasal exosome, which they can apply, and that goes straight to the blood-brain barrier. And the treatment on therapeutic continuation is dramatic by intranasal exosome. So yes, we can use stem cells, but stem cells in combination with exosomes is the best.
I see. So that's very similar to just like a squirt of
nasal spray.
nose.
I was full into the nanometers of the nasal spray and how much it should be, exact nanometer for the vesicular size for the process. And then we found out that it's basically the same type of plastic nasal spray device that the companies make for nasal decongestion, for example.
Right.
So it's basically like a nasal decongestion spray, but with life-altering exosomes.
And do you make that yourself?
No, the actual company makes the exosome. But of course. And it's all under GMP and CMP conditions, fully accredited, both international lab accreditation and also by the Ministry of Health in Turkey. So it's one of the few laboratories that are producing stem cell products, cord blood products, that is internationally recognized, internationally accredited, and has full licensing accreditation by the Ministry of Health and the government body. So, I
Okay.
mean, there are a lot of companies all over the world, Ukraine, Cuba, countries like that. You don't know what's in their lab, what they're doing, you don't know where they get the material from. These are questions that we asked and were answered by them as a company.
Well, I'd love to delve into the international perspective around stem cell treatments because I know a lot of your education was in the UK, your company is kind of based in Turkey, and in general, I think in the US there's a perception that stem cell treatments are only accessible in Europe and like in Europe they sell placentas from birth. Like there's all these conspiracy theories. And so yeah, I'd love to get your thoughts
Yeah.
on why stem cell treatments appear to be more accessible in Europe and how you view that access.
Again, the irony is, even though stem cell treatments are more available in Europe and Central Asia, when it comes to cord blood banking, the most you'll see is about 3% of every birth in the USA.
Yeah.
They collect their cord material, which is the opposite, for example, UK, where it's 0.3%, in other countries, France being 0.08%. In UK, it is still around 0. Again, is this socioeconomic reasons, or is this due to lack of widespread education of the public? For example, in Turkey, Greece, and Cyprus, most patients go private. And in the past 2 years, 3 years, where your gynae doctor will say, are you aware of blood biobank? Are you aware of keeping the cord blood? Some of them will just leave it at that, but others will explain why they think it's a benefit to them, the benefit to the patient. Those are doctors which have had personal professional experience with cord banking and seeing the benefit. So again, why is STEMS so more available in Europe? The places which are offering it for medical reasons, not for rejuvenation. The market in the USA, there's a lot of exosomes, but again, are they exosomes? Exosomes are pretty fragile. Are they actually exosomes? The amount of people in the USA, it was shown that they weren't stems. There was no viable stems in the treatment that were given. So again, at least in this part of the world, there are a lot more regulations. The products have to be tested by the government. They have to have certification. They have to have show certain cell viability. There should be a certain number of viable, healthy, vigorous cells for it to be signed off. And of course, the biological screening for viruses, hepatitis, bacterial infections, genetic abnormalities. And of course, there's a lot of screening for the biological problems for infection, viral, bacterial, even fungus, which is lacking in the USA. Again, it's down to the fact that maybe in Europe, medicine and healthcare has traditionally been socially provided by the government. It's
Yeah.
not so much been a private endeavor. In the USA, it's always been slightly aimed at private.
I see. I've read that Portugal strangely has around 10% of people banking. Do you know why that is versus like you said in the UK it's like point zero, less than 1%?
Portugal is a wonderful country. I love Portugal. I've been many times. Portugal in itself has always been ethnically and European-wise, always been different. I mean, when Portugal was, the rest of Europe was at war and Portugal was discovering the world, so to speak. South
Yeah.
American and India. So for them, it's quite expected, really. They have a different take on things. So I'm very happy.
Interesting. What areas of umbilical cord and placenta stem cell research are you most interested in and think that there's the most promise for the future? And especially like what diseases?
Projecting 5 years, 10 years, the way the current research, the current clinical trials are going, we'll be looking at individually tailored stem cell therapies based on either autologous cells or allogeneic materials. I think projecting that 10, 15 years, I think most of these therapies will be autologous because people will be biobank when they have the chance. So that's where I think it's going. Tailor-made, genetically tailored treatments for certain diseases using the person's own biobank material from their birth.
Yeah, I know cancers are typically a common use case, but are there any other use cases that you think would be really promising in the next 5 to 10 years or things that you've seen kind of early research in? I feel like autism definitely.
I mean, Parkinson's, these kind of diseases, Parkinson's, and Alzheimer's. I mean, we're at the moment where it's all about in situ placement of stem cell matrices, or opening up the skull and bathing the brain in stem cell solution, so to put it in a very loose way. I'm seeing the future where there will be matrices with live living cells producing exosomes, stem cells, cells exosomes, which will be placed intradermally under the skin, over the thyroid, for example, releasing slow but sure amounts of the person's own stem cells to boost recovery, for example, traumatic car injuries, traumatic spinal injuries, post-brain bleeds, where it's not as simple as just you've got to wait for everything to coalesce, blood to go down.
And in the past 5 and 10 years, what advances have excited you the most when it comes to umbilical cord and placenta stem cells?
Exosomes, simple as that. Exosomes have always been known to be the actual driving force behind stem cells' potency itself. Stem cells produce exosomes do the work.
Yeah.
But before, exosomes were historically difficult to isolate, difficult to purify, difficult to purify and collect in large amounts. Over time, we've seen a reduction in price. If it's easier to collect, if it's easier to purify, if you can do it in a shorter period of time, then the medicine itself has become cheaper, before it was quite limited by the price. Now, because it's more accessible, we're going to see a lot more use of exosome going forward, definitely.
I see. Are there any case studies in the past 5 or 10 years looking at specific diseases that you found really promising? Like I know in 2022, there was a lot of buzz around HIV being treated with cord blood, for instance.
Yes, I remember that. Not only cord blood, but placental stem cells derived from the placenta as well. And I think the idea behind that was resetting the immune system by giving new instructions with cord blood. HIV is a infectious disease. In my opinion, the research was not flawed, but it was trying to use a cellular approach for a viral problem. Now, you can do that in certain viruses, for example, CMV, cytomegalovirus virus, and other inherent genetic modifying viruses that are found in the population could be treated with cord blood, but we don't know the effect long term. For example, if we give the cord blood for certain viral infections, does that improve the patient's response, or does it make it worse? I mean, the research at the end of the day was non-specific. I mean, I think, was it 52 or 58%? It showed some improvement, but then the long-term mortality decreased over a period of 6 to 12 months, 18, 24 months, I'm not sure. In the long run, when you look at the long-term survival rate, they show no difference with the application of stem cell before after in this population of patients.
Awesome. Well, yeah, that's all the questions that I have, but I'd love to, typically we ask at the end of our episodes if you just have like a general message for pregnant parents, what would it be?
Always think positive, but prepare for the worst. First child, second child, doesn't matter. I think you should always be prepared. And if you have the socioeconomic means to bank privately, do it. If you can't, always consider donating after birth what you have to a public bank.
Okay,
Definitely.
awesome. Do you have kids yourself, and did you bank?
I do. We banked for the first one. Second one, we didn't bank because we couldn't. Where we gave birth, there was no infrastructure for biobank. The guy was supposed to get on a plane and come down to the island and then collect it and then get back on a two-stroke and on a big plane and go to the mainland. So we kind of said for that one. Even though the company was very reputable, representative, was really informative and really helped. But at the end of the day, it was a matter of we weren't sure about how long it was 18 hours, 2 planes and a boat and I was going to say train, but boat and a coach, so to speak. So we weren't pretty sure of it. Having said that, I mean, our second child has certain developmental problems. So, I mean, at the moment, we're ourselves using exosome stem cells to treat her. She's seen some improvement, but she doesn't like the spray. She doesn't want the spray. She's always fighting against the spray. But I mean, yeah, we'll see.
Interesting. That's awesome. Well, yeah, thank you so much for being here. If folks want to get in touch with you, or especially if they, for instance, have a child with autism, how should they reach out?
They can check us out, so to speak, at vitalia24.com. And from there, if they want to discuss their child or patient, they can reach us via email. Then we can have a look and give them an idea about what's viable, what's not viable, what's most.
Okay, great. Well, thank you so much for being here. This was really great. I
Thank
know it
you.
was a slightly longer episode than we anticipated, but yeah, it was really
Yes.
fascinating, and I'd love to continue the conversation.
Good, good,
Okay.
good. I have complete anxiety about talking, but
No,
otherwise,
no, don't
otherwise,
worry. It was
we'll get
great.
it.
Sounds good.